Plague Doctor, people today are curious. Help us understand the difference between social distancing and quarantine.
A good question. Social distancing and the quarantine. What are they? When do we use each? Social distancing is for everyone. It is to prevent the spread of germs among folks who seem healthy. The quarantine is the most extreme measure if one is already ill and contagious, and also sometimes for people who are very vulnerable. To stay socially distant simply means don't go out if it isn't really necessary. When you do go out, wear your mask. Be sure to wash your hands often when you come and go or when you're handling new objects. Stay 6 feet distant when you meet another. Go about essential business, but leave the visiting and unnecessary trips for a healthier time. The quarantine is the more extreme measure when one is ill or very vulnerable. If you have become ill yourself, you should quarantine for at least 14 days or until your symptoms have settled, plus 3 more days to be sure. Now, there are situations with your particular plague that become what we call a long haul. The symptoms go on for a very long time. In those cases, one should be working closely with their doctor to understand at what point they are no longer contagious. A quarantine means truly no contact. If one lives in a shared household, it is best to designate a sick room where the quarantined person may live undisturbed. If the house is generous enough, ideally it would be wonderful to have a separate bathroom for the person who is quarantined. In your time, as certainly in mine, a private bathroom is often a luxury that is not available to everyone. If a quarantined person must share a bathroom with housemates, the bathroom should be thoroughly cleaned between each use. If a person is alone in quarantine, it is important that they receive support from the community in safe ways. When one is ill, preparing food can be quite a challenge. Friends and loved ones should deliver meals, pre-prepared if at all possible, leave them safely at the doorstep, step far enough away, and then call to notify the person that they should pick their offerings up. If one is in quarantine and becomes extremely ill and needs a hospital, by all means they should receive that care. If necessary, call 911 and let the ambulance know that this is a person who has been in quarantine. There are precautions that medical professionals can take to reduce the spread. Remember, quarantine is intended to preserve life, but it is also a strain. If someone you love is in quarantine, please do stay connected to them in safe ways. You have this magical video screen you can talk to them through. You can leave off gifts. You can stay in communication even without catching germs. And if the quarantine serves well, a person shall hopefully recover and soon rejoin their loved ones in healthier times. Again, to avoid the need for the more dire quarantine, as much as possible, Stay socially distant. Keep 6 feet apart. Wash your hands frequently. Wear your mask. And go out only when there's really a reason you must.